clinical features, right? After we do clinical features, we're going to be getting to some of the claim stuff, and then we'll take the questions, okay? So just remember, this is some of the stuff you've heard about on the clinical features of who gets this. By the way, keep that in mind. About 80% of the deaths are the elderly, right? Median age is 80 years old, okay? Median age of this, 80 years old, about 40–50% of the folks are the ones that you have to keep in mind are the source of the deaths. And then you've probably heard about this. So this is going to be the kind of stuff that you need to know about the hypertension, obesity, the diabetes, those kind of things, right? What are the symptoms? These are some of this data from the literature about the different symptoms you may have heard about, right? About what the patients will be putting down their claims, what they will be talking about, what they'll be referencing when they said that they got exposed. You'll hear about some of the manifestations, some of the complications, right? So there are some neurologic complications that people talk about. This is summarized in one of these studies, right? In this study, about 13.5% of the people after 2 days after infection had some kind of neurologic or clotting trouble, right? And this is just a schematic just to show you what some of the patients could experience where they can get those clots in the circulation, okay? So how does those clinical features look, right? So you're going to have the asymptomatics, right? Very unlikely to see asymptomatic in nursing homes, very likely to see it in prison population, right? And then you can have the mild infections, pre-symptomatic, those that have the mild upper respiratory, the lower respiratory, and the worst one, the ARDS. And so it depends on the claim you're looking at, what kind of symptom reporting they're going to be given to you, okay? And so when you have the pneumonia, it's generally viral, and you don't treat those with antibiotics, right? The more worrisome ones is what's called the ARDS, where they get some problems deep into the lungs, right? Keep this in mind. Here's a number very helpful for you. This usually hits about days 4 to 7, right? About days 4 to 7. So if somebody's going to generally get into the big trouble areas, right? The ones you're going to see the claims that they had to be hospitalized, they're usually going to be early on in the illness when they had a big decline in their ability to function and be able to get through everything that they wanted to get through, okay? Next, ARDS. Why do we care about this? Why do I want your attention on this one, right? Because in the claims, when you get to ARDS, right, when you get to that reaction that's more severe, more involved, that's when you start seeing those long-term implications of lung volumes, right? That's when you can see some cognitive changes, psychiatric changes, muscular changes, right? So this is important because when I'm seeing these claims, right, what we're trying to say to them is, look, at about 6 months, you can often have resolution. Some of them can take years, but that's one of the things why I sometimes say, look, I need to reevaluate somebody in 3 months, 6 months, something like that, because sometimes these take time to clear out, right? There are some later problems, right? Guillain-Barré, PTSD, the long COVID, right? You may have heard of that, long COVID, long haulers, right? Those are all ones that can come up, and we're going to talk about that when we get to claims, okay?